The POSLink Plus Listen podcast is recorded on the unceded lands of the Kulin Nation. Hello and welcome to POSLink Plus Listen. Today, Joy FM presenter Dean Arcuri talks to Vic Perry from Living Positive Victoria about his retirement from the role of Health Promotion Officer. Vic's remarkable career in the Victorian HIV sector has spanned 3 decades, including 2 with LPV. His passion, wit and charm, advocating for people living with HIV and most recently people ageing with HIV, has made him a pillar of support for many in the community. In this episode, you will hear him talk to Dean about his personal journey, which has led him to such a fulfilling career, and what's next for him as he thinks about life after work. Enjoy.
Okay, I don't know why you're nervous. It's really hilarious.
Maybe it's this week because it's
well,
so close to Thursday.
You're a couple of days away from your retirement now, aren't you?
Yes.
How are you feeling right now?
Yeah, it's a bit weird, a bit surreal. I'm good. It's a good feeling overall, but weird that after all these years of doing a particular thing, and it's been mainly HIV, health promotion, peer support, all of that stuff that has been fantastic, and now all of a sudden, bang, it's going to stop.
It's going to
kind
stop.
of, you know.
Well, why now? Was it I'm at that age now, or it's time for upward?
It's a combination of reasons. One thing that prompted it, firstly, was I needed some money because I've just fixed up a rental, and I owe my brother some money, and I'm thinking, I don't like owing people money, and I realised at my age, and there's this thing called preservation age where you can access your super at a certain age before official pension time. I was able to do that, and I thought, okay. And then I realised at the same time, I thought, hang on, but I think I've done enough anyway as well, and I think it's time.
Yeah.
I think after a while, one should realise that you've done your time. Let someone else come in with fresh ideas, fresh outlook on things, and I thought, give someone else a go, and just feeling it too, and feeling a little bit tired mentally and physically, because you do,
Oh, look, I feel like so many people are feeling
age.
that now. I don't think it's just an age.
The environment too,
the space we're in now today, a lot of people are feeling that, so they're creating different directions and pathways for themselves. It is going to be strange though. Like, you're a big fixture in the community in so many different ways and places. But let's kind of go backwards to the very early years that brought you to here. So, how did you realise this is who you are and this is the space you wanted to be in? That's a big one I'm going to throw at you at the start.
I guess as I was growing up, and like the son of migrants, like many others, I wanted to fit in and just do my own thing, and sort of navigating 2 worlds of one of the expectations and the obligations of my family and community, that kind of thing. But realising that, hang on, I'm a bit different. I'm not exactly what they think I am, and so when I started to socialise and started to connect with the queer community, which was about 1980, I thought, this is who I am, and this is what I want to do, meaning that I wanted to actually get involved. And so as soon as I left my work at the time, which was a mainstream kind of organisation, for want of a better word, I started volunteering for the Victorian AIDS Council, Gay Men's Health Centre, as it was called back then. And
do you remember the very first kind of volunteer shift you did?
Yeah.
What were you doing?
I do. Sitting at reception.
Oh, okay.
And it was the Positive Living Centre when it was in Ackland Street. And this is 1995, I think, and I'm sitting there answering the phones and welcoming people as they came in for lunch and that kind of thing. I also drove people around to medical appointments that kind of thing. And I enjoyed that because I wasn't just doing those things. I was also talking to people, and as people do, and very much so back then, talking about their problems and issues, and ranging from emotional stuff of disclosing their status to people, and all sorts of things that I was getting involved with. Just something in me, I sort of felt compelled to add my 2 cents and give a bit of advice and guidance, and I reckon this and I reckon that, kind of thing. Not being prescriptive and not telling people what to do, but
I don't know. Maybe it's that multicultural part of us. We can't help but just help but give our opinion, can we?
That's right. I got it from my parents, especially my mum, and I was sort of helping people to look at things differently, or trying to add a better or more optimistic perspective, or and then it just seemed, I guess, that caught on with the management at the centre, and when the peer support officer role came up, they offered it to me, and I thought, as in paid.
How long had you been volunteering before that happened?
Maybe, that's a good question. 6 months,
wow,
or something, not long.
I guess you made a bit of an impact.
I was enjoying it. I really enjoyed and I enjoyed the space, and the biggest thing I found that was incredible was being able to be safe and be openly positive in that space. Whereas before that, in all the other organisations that I had worked, I never came out about my status, because I just felt that, as we all do when it comes to disclosing your status, you worry about rejection, because there's a stigma and that kind of thing. So I held my positive status to myself for quite a while.
So from that point that you were volunteering and stepped into this role, peer support role, how long had you known you were HIV positive?
I was diagnosed in 87.
Okay.
So 1987. So that was a time that there was a lot of stigma. I didn't tell anyone. I was even offered, in fact, apart from being told that I only had a couple of years to live, which was just blew me away. And I thought, well, what the hell do you do with that kind of information? Well, and lots of people did lots of things. And one common thing where people just gave up work and cashed in their super and went on a trip and did all those kinds of things. Whereas I guess for me personally, I was healthy. I felt fine, and I thought, well, I don't want to do all that and sort of create upheaval in my own life. I just want to keep going if I can, and I did. So, so for a number of years, I kept it to myself. I was offered counselling. I thought, I'm not going to talk to someone about this. It's too personal, And I had a little bit of the shame and the guilt there, which kept me from telling people.
It's funny how we do that to ourselves, isn't it?
Yeah. You could easily argue it's totally unhealthy, and you should talk to people about all the logical stuff.
Everyone has their own pathway when it comes to this, though.
Exactly. And I thought to myself, I feel okay, and emotionally I was okay as well. So I crossed my fingers and I thought, let's just keep going, keep working. I went to uni. I thought a relationship, maybe not. But it happened, and I'm still with my partner 35 years later. He's HIV negative, if I can say that, in this podcast. So that worked as well. Bought a house. I just kept living as if I was going to live forever.
Wow.
So I didn't change anything to suit or to match the prognosis of 2 years that I got years ago. I just kept going.
So when did you start publicly letting people know you were HIV positive?
I guess it was when I started volunteering to the PLC. So that's 7-8 years later.
I mean, it speaks to the impact of what that experience had for you.
I guess...
No,
I'm the way I view it's about identity, and the way I view my status is just one part of me, and I've always felt that. Even with my sexuality, when I started to deal with that, I didn't sort of think, right, I'm going to be an activist, I'm going to march down the street, and I'm not going to wear it on my sleeve. It's just a part of me, because I didn't want to give up anything else that I had in my, let's say, previous life. And that was, the culture from having Italian parents and my straight friends. And, I didn't want to sort of break off all of that. I thought, no, this is just another dimension, another part of my identity. So when the status came along as well, I thought, this is something else. And so I'm the sum of all these different kind of intersections, which I value all of them rather than just one.
I feel like that's a comment that many multicultural people have. Our lives are a part of something bigger, and it's not just one thing where it needs to sit. Yeah. And that's something I think a lot of people can resonate with and still resonate with today.
I think it's a healthy way to do it. It's a perspective that matches what we should all be doing and having balance in our life. So it's part of the balance and part of living different bits of your identity and not going too crazy on one of them. Some people do that, and that's fine. I'm not criticising anyone who does that. But for me personally, I found all these years later, I'm happy, very happy with the way I've dealt with it, the way I've done it.
Yeah. Well, then you've stepped into the peer support role.
Yeah.
Got a paid role. Wasn't expecting that.
No.
What did that look like?
It wasn't easy. We're talking about the late 90s, and in the late 90s, that was peak AIDS deaths in Victoria at least, and so a lot of people are dying still, and so being in that role, I was heavily involved and exposed to a lot of grief and trauma. But I guess my personality has always made it, you just deal with stuff. Things happen. My parents, both died, and I never fell apart. I just sort of dealt with it, So you got to deal with it and work out the best way to move on. So it was kind of tough, but at the same time rewarding because I was helping a lot of people as well.
Is that what gave you that kind of balance? Because that must have been really difficult, not only doing the job, but also, living with HIV with your own prognosis as well, and just finding that balance for yourself.
Yeah, I guess I was projecting in how I dealt with HIV and happy with how I was dealing with it. Notwithstanding the disclosure part, that's always, even today, it's not an easy thing to do. But that aside, in terms of how people feel about being positive themselves, that can be quite traumatic. And so I guess, all the sad or grief or everything I was experiencing, I was doing my best to help people in either in those situations or not even in those situations, even particularly newly diagnosed, in helping them how to have a perspective, giving them a different outlook and different way of looking at their status, and hopefully they would appreciate a different outlook, that it's not all doom and gloom, even though we're talking about the early days where treatments weren't that great, and there wasn't a lot of optimism in the air. But, despite that, you can still feel okay. I'm not talking about feeling fantastic, because that's not me. It's about okay. I like to cruise along and feel okay about things. I don't need to be up in the air being fabulous all the time, which some people like to do that. But I often see people who do that and then crash and burn. Yeah. And then they go up again and they crash and burn. Whereas I like to cruise. I just like to do the best I can, calm, relaxed, and just cruise along, which I think is a part of the secret as why I've lasted so long in the sector. I always remember something my dad, had a few gems of wisdom, and one of the things he said to me, which sounds odd, Vic, just remember, don't ever work too hard. And I know what he means. I mean, do the best you can, and do what you can, but don't stress out. Don't go working, burning the candle at both ends, or because he meant too that life is about working, but it's also about playing. It's also about family. It's also it's a whole bunch of things, referring to what I was talking before about a balance and having multiple identities and not focusing on just one thing. So yeah, I always remembered that, and I actually did it. I made sure that I never worked too hard,
Yeah.
if you know what I mean. I just sort of cruised along and did what I did the best I could, and yeah, I'm still here. Anyway.
Do you ever reflect and think about just the impact you being you and the space you created for people has? Some who made it, some who didn't.
Yeah,
And what a help that may have been.
yeah, yeah. Over the years, there are people that have either passed away or, I guess, not in the best position or not in the best state, and where I thought, oh, I wish I could have done more, or wish I could help them, or But I've learned to realise too that you can't do everything for everyone. There are things that are out of your control, so you always got to look at people's context, and you can do the best you can in what you know and what your skills are and capacity, but there's other stuff going on as well, and there are things that you can control, things you can't control. So there are some people that I just feel that I wish I had more influence or impact, and emotionally, physically, but it's like the cruising along. Do the best you can. I know my limits. That's another, I guess, thing that people tend to forget, and that when they try to do everything, it's like no, I know my limits. I know what I can and what I do and what I can't do. And this is a bit of advice I give to new peer support.
Well, for those that may not understand, what exactly is the peer support role?
Yeah, good question. What is it? The definition of a peer support. It's kind of, I guess, evolved over the years, where peer support used to be that you couldn't do much in terms of people's health, and particularly before treatments came along, and so peer support was very much an emotional support. So it's really just talking to someone and hearing their story, and peer support, meaning the word peer being the operative word, where you're HIV positive just like them, so they feel that they can talk to you because you have empathy. You've got at least that, not just the knowledge, but you're being positive, that just can make a big difference in how a person feels when they're talking to you. So it's very emotional. It became, treatments came along, and so a lot of more information. And so, being a peer support worker or officer, you've had to sort of arm yourself with all that info so you can impart that knowledge to people as well, particularly treatments, which was an area that I really got into.
Yeah.
Because I felt
Well, I mean, that was
was
constantly
important.
evolving as well, and
Constantly
growing.
evolving,
Yeah.
and members, clients, have no way in trying to keep up with that kind of stuff, particularly if they're already working or they're busy in their lives. Whereas it was my job to keep up with that kind of stuff, which I did. And there were other. Fortunately, I guess the whole sector evolved too in terms of functions and jobs, and so other people would come along and do other things like financial support or housing support or all these other practical kind of things. So I did a bit of that, but I still focused more on the emotional side of things. And then in my later years, focusing on ageing, which I've been doing for about 8 years, back to the practical side of things that are more pertinent to ageing. And so I've been focusing more on self-management for people as they get older. But peer support itself, it's really important. And the HIV epidemic, sort of when it came along and created this peer support worker, it might have been the first ever role that existed in any kind of industry. And because you see the evidence you see now, and peer navigators, which is the latest, I guess, iteration of peer support, which involves a lot more than emotional stuff. There is a lot of practical guidance in peer navigation. But you see the title peer navigation in so many other areas as well now. So it probably started started in HIV. I don't know, I'm just guessing.
Oh, look, it might have, but I mean, its importance. We now understand its importance in a much different way.
Can make a big difference, where a person will open up and just feel so much better talking to you if they know that you can relate to what they're saying.
Yeah.
It's a big thing,
So when you were talking about all those different groups you'd been a part of in different ways over the year, that's something many of us in the community do. Like we find a space, whether it's Joy or a community group like the Vic Bears, and create a space to just explore and do things more. What was that for you? Like what made you want to jump into those different arenas?
Oh, mate.
I feel like Vic Bears will be very easy to answer.
Yeah.
So let's talk
That's
about
right.
let's talk about Joy instead.
There's a group of people to
Yeah.
look
They
like,
look like
just
me.
like me.
Yeah.
So that was easy, and that was good. And I've got to say this, but that culminated in me getting a life membership for the club, because of the work that I did with them on the Australasian Bear Contest, co-comparing a number of those events and helping out with other stuff. So I appreciated that. It was really good. In terms of things like Joy Melbourne, that kind of started through work, where in the late 90s when I was working at the VAC, I had an idea of I sort of wake up one day, I thought to myself, what's a good way to get out there, messages and out there and health promotion, and because we weren't doing radio back then. There was a radio program that someone was doing that I think wasn't part of the VAC. It was something separate that touched on sexual health and HIV. But I thought, you know what? I'll do this part of my work. So I put in a proposal and said, I've got this idea for an hour a week, HIV, sexual health, it got accepted, and I started Positive Life, I called it. And it was basically, I was just interviewing people just like this, week after week. And it was all sorts of well-known people in the community. They were doctors, they were community members, people from various organisations, groups, just a whole range of topics around HIV, particularly treatments. So it was good. It was about 5 years it lasted.
That's a long time.
Not too bad.
It's a long time. Like some people last 6 months now. They put on a show and go, well, I've done everything. There's nothing else to do.
Oh, all right. Yeah. It seemed very short. So, and that was good. And it was similar to with Ben TV. I thought, what's another way to get HIV out there, and I thought TV, because there's nothing on TV on a regular basis anyway. So I got involved volunteering with Ben TV, and I started producing and presenting programs. They weren't HIV focused, but I made sure that there was HIV in it. So whenever PLWHO Victoria or Victorian AIDS Council, again, old names, whenever they were doing stuff like campaigns or needed to get stuff out there, I made sure I got them in and interviewed them on these shows that I was producing. So,
I mean, and those spaces still exist now in different ways, just like what we're doing right now with this podcast. But it speaks to the importance of creating space for voices in our communities in different ways. Yeah, that's what you did, whether it was getting up on a stage, hosting a competition with Vic Bears, or, multicultural groups, or, just being a part of things to create avenues to talk to. It broadens things and opens them up more.
And gives people out there who otherwise may never hear of this kind of stuff an opportunity to hear this sort of, either see it on TV or hear it on radio. Just keeping it on the agenda. It was important to have HIV kept on the agenda and
still
keep people aware, and it still is today. Probably more so today, because we've reached the point that we have done such a good job in thinking about the bigger picture of the epidemic, and Australia is a model that other countries look to, and they do say how we've handled it has been phenomenal. But it's been so good that the mainstream community has kind of thinks, oh well, it's all sorted. They're fine. They don't need any support anymore. They don't need funding. They don't need anyone to think about it anymore. And it's like, no, not exactly. We still need to be aware of what the issues are, and yes, it's much better today than it's ever been, but it's still not perfect. It's still not there.
Has it surprised you to see that evolution and to see where we're at now?
Not surprised, but glad. It's interesting at the speed. We in medicine, particularly around the treatments and other advances in our knowledge in how HIV works. I remember reading that the area of HIV medicine has been the fastest growing area in any kind of medicine ever. And so how did that happen? A virus, how did it become a thing that people just sort of latched onto, whether they were community workers, researchers, government funding helped, has become this area that's really just sped along and produced treatments and support and services. Since the early 80s, we've sped along in terms of what's been achieved, and apparently it's the fastest in any area of medicine. So it's kind of surprising and interesting, but I'm grateful too. It's fantastic because for me personally, it involves me. I can talk all about all the stuff that I do and all the work, but there's also me. I'm HIV positive, so I have had to deal with the changes and advances in treatments, for example, which is interesting because I just changed my treatments for the first time since I started treatments in 2004. Which has been an interesting experience.
Wow. Like recently?
Yeah. It's I've been on a drug that's been around for a long time, and it's been working for years, and there's never been a reason to change. So it's the kind of thing, the old thing of if it ain't broke, don't fix it. And so it's only recently that I had to change because the drug that I was on was being discontinued. So it wasn't really
as reasons go, that's okay.
So it's been an interesting experience. But it's interesting that I am going through these things myself personally. At the same time, when I talk to clients or members who talk to me about these things. And again, that gets back to the value of having peer support, having someone who officially is in a role that gets paid to do their job. It's their job to help you with the stuff that you're going through, and they can help you in a way because they're going through it as well.
Well, when you were going through this change and having some of those thoughts that some people may have or thinking about what that means, did you reflect on your own experience as a peer supporter or reach out to someone else for that support?
I guess it speaks to how I am, my personality, that I've always been fairly independent and I can help myself. I don't need to talk to anyone. I don't need anyone else to tell me what to do so I've always sort of I've just never felt the need to ask people for advice or guidance, but it's just me. I'm happy with the way I think and how I deal with stuff, and I'm happy to help someone else. But like I said before, when I was diagnosed, I was offered counselling, and I just thought, the main thing was because I didn't want to talk to anyone about it.
Yeah. Because that's what I'm saying. This is not a new experience. This is something I think many people can relate to. I think many people are the reason why I asked the question is because I don't think this is a new experience. And it's something that a lot of people listening can relate to because we're all kind of like that.
Yeah. And it's simply about a satisfaction with the way I do something, and that's it. I'm not saying it's the best way. I'm not saying it's the way that everyone should be doing it. It's just for me. For me, it's worked.
Yeah.
I think I've done all right. I haven't regretted anything. If you want to ask me a question about regrets, I have no regrets. I don't think I've had any or gone through any disasters or bad choices. Or I think I'm happy.
It's funny. That's something I do hear from a lot of older people in the HIV community, because they had to come to terms with what their life was, and especially being diagnosed in the 80s and early 90s, what their life was, what it was going to look like, and shift and change that. So the way they get to sit in spaces and the outlook they get to have is something that's completely different to those who are diagnosed now have. And we're lucky that we live in this space to be able to have, those people to listen to hear and share their stories, and like what you're doing now, just talk about your own experience. You said you never set out to be an activist, and I feel like you're going to fall into the same pattern where a lot of what we're talking about is kind of falling into, where it was just like, this is what I'm doing, this is where my work sits, and this is how it is.
And it's activism. I guess another word to define, what does activism mean? And it means different things for different people. And for some people it means wearing HIV in your sleeve and telling everybody about it, and marching and protesting and being on the media all the time about it. For me, I guess my kind of activism has been more person-centred rather than the big picture policy procedure, big change.
I guess because other people were dealing with that, so you got to look at the human face of it, which is what you were doing.
I always felt that. I thought, Vic, there's plenty of people who do all that stuff, right? So do what you want to do and what you're, and do the stuff, which is, I guess, a reason I left my previous work in the early 90s to get into something like this, was because my previous work didn't leave me satisfied.
What was your previous work?
I was working in science. I was technical officer with CSIRO, and I loved it, and it was the kind of thing that I always wanted to do when I was a kid. When I was a kid, I just wanted to be a scientist. That's it, simple as that. So I'd started doing all that and went to uni and got my degree and did all that. But after a while, I thought to myself, I don't know, you do all this work, which is really important work that has to be done, but it takes time, and you don't get thanks, you don't get results for ages, And so when I was getting my long service leave, I was there for about 10 years, and I thought to myself, it's time. And I guess I was there for long enough. And I guess in that time, which is interesting because here I am 30 years later.
I was about to say,
It's like, whereas after 10 years of that, I got over it. But after a long break, because I had a holiday and I think it took me months before I started to think, I better start working again. That's when I thought to myself, and a friend of my partner at the time, he's still there. No, at the time, a friend of my partner at a dinner said, I volunteer for Victorian AIDS Council, and it's really easy, and you can do all sorts of things, you can reception. I thought, so volunteer, and I never thought of that before. Never thought of volunteering in any kind of capacity. I thought, and he did mention that it can be a way of getting your foot in the door and progress, and perhaps go for a job if something comes up and all that sort of stuff.
And who knew? 6 months later.
And it kept going. And I must admit, I'm incredibly grateful of the work that's been offered to me over the years, because I hadn't been for a job interview since I left the previous workplace.
Wow.
Because as I was with the Victorian AIDS Council, the work just came along. And people just kept offering me work, and then I started working at Arches, Australian Research Centre in Sex, Health and Society, and worked there for a couple of years. Funding ran out, so I had no choice. And then I was offered a job with PLWHA Victoria because I had been volunteering with them for a number of years, and they got funding for the very first time, got funding to do health promotion. And I had been doing health promotion as a volunteer, doing workshops and things like that. So I guess they saw the value of a continuation of using me to run health promotion programs. You get thanks for it and it makes you feel good, but you see the value that you're adding to people's lives. And that, I guess that's the big reason why I've been doing what I've been doing all those years.
It must be hard to kind of go, in a couple of days, that's going to be wrapped.
Yeah, but
for you?
in order to avoid what's that phrase, something retirement syndrome, because I've been trying to do
What's
this
your plan?
strategically.
Yeah.
Well, I've been trying to think of doing it carefully, so I don't get a shock and think, and wake up next week thinking, oh my God, what am I going to do? Because it's about my identity as well. We're talking about that part of it as well. So how do I avoid a shock? And so there are things that I'm going to continue dabbling with, various projects. So LPV has an incredibly important project called the Positive Speakers Bureau, which is basically about people going out there, people with HIV going out there, the mainstream community, and talking about their lived experience with HIV, sharing information around the latest advances. And that's probably one of the best ways, if not the best way, to address stigma in the wider community, which unfortunately is still there.
Yeah.
We talk about all these advances and how well we've done as we've come along with this epidemic, but the number one thing that's still an issue is stigma. So the Speakers Bureau has an incredible, important role in that. So I'll continue to be a part of that. And there's a couple of other projects. So it's about staying connected. I'm doing this to stay connected. So it's not... I'm not closing the gate and just leaving forever.
It's not retirement like it sits in so many other people's spaces and places, but it's stepping away from peer support.
Yeah, it's stepping away from the day-to-day, but I guess what a current or what a job entails, all the things that go with being in a job where a lot of responsibilities and obligations in a job on a regular basis. You talk about deadlines and things like that. I'm sort of giving that up and doing other things in my own pace.
Yeah.
So I'll be able to say no when I want to say no, and I can just do things in my own time without saying, well, Vic, we're paying you, so you got to do it. So obviously they don't say that, but you feel that it's your responsibility. You've got to do something.
Do you reckon in the past few years you're working in that spectrum of, getting old with HIV has created a nice pathway for you to step into this new space and place?
I was thinking that while I'm working, because I actually, before I'd made the decision, envisaged that I would continue working and focusing on ageing and thinking, well, this is me as well, so I'll take advantage of the knowledge and experience that I'll gather as I'm in this area. But now that I decided to retire, it's like, oh, okay, it won't be so intense in terms of the experience, but I'll still take advantage of the community that's there and the knowledge that's there.
I need to ask you, bucket list, first week, first month, retirement. Yeah. What are some things you want to do? Is it watching a movie? Is it watching a soap opera?
I've got a list as long
Is it
as
planting? What's on the list?
I've got to clean the house. And tidy up the spare bedroom. That's an absolute pigsty. Looks like an episode of Hoarders, because I keep delaying and thinking, I'll do it when I retire. I'll do it when I retire.
Now you can't use that excuse anymore.
No, from next week I've got time. So, and Rob's, my partner's reminding me that I've got time now to do all these things. So yeah, tidy up the house. Nothing specifically. I've got social engagements or things like that that'll continue, and I'll have more time to do more of that. Though I'll have more lunches with friends and more outings on weekends, or
more time for you.
More time sitting on the couch and watching TV, whatever's on.
What's your go-to at the moment watching on TV?
Squid Game 2
okay.
has been interesting. Night Agent. So I guess, Netflix stuff. But I'm a sucker for those reality shows too. So I've been watching Survivor after having finished the one before that. What was that one? Celebrity Get Me Out of Here.
Oh, Celebrity Get Me Out of Here. So you like that kind of thing?
Yeah, but not as in, I'm not a mad oh, here we go. This sounds really awful.
I love that you worry that you're going to fall into a pit hole that's going to insult someone else.
And people are going to say, Vic.
You say you're not a mad person, but you've watched I'm a Celebrity. You're watching Survivor at the moment. You absolutely are. Enjoy it. You love reality TV.
And we do. We watch it when we're having dinner. So, we pick at people and, we make comments.
It's okay to have a vice.
I know. And just doing family stuff as well, which I'm sure people think, Vic, you're retired, you can help me. Whether it be my brother in his place or cousins or, so these family commitments that have always been there will probably increase, which is fine. I'm always happy to help out. Family, salami time
make salami,
and tomato sauce, sauce day. I've got cousins that do all that and say, Vic, it's time, and that's fine.
You'll get to be a part of it.
Well, and I've enjoyed the
fruits of the
results
labour.
of all these. Tell you what,
since it's been announced that you're retiring, it's been shared on social media. Have you been touched by the response that you've received from the community? It's broad. It's
fantastic. It's just, I guess, seeing the diversity in who they are and where they're from, and reminds me of, I guess, the breadth of work that I've done in so many different places and jurisdictions, interstate even. It sort of reminds me of all that, but makes me feel grateful that I've been able to spread my love. What a phrase. Spread my knowledge and skills and help people out in not just directly with LPV, but other organisations and other places. I've always been ready and happy to put my hand up and say, yeah, I'm happy to do this. Whoever asks me to do whatever program, whether it be facilitating a workshop or emceeing an event or whatever it is, and it just makes them feel that, like I've said before, I've done okay.
Yeah,
then.
You've done all right.
I'm not going to say, haven't I been fabulous? No, I've done all right. I'm happy with what I've done.
You've made an impact. You've made a big impact. You've been doing it for many, many years, and it's nice to see people appreciate that and appreciate you for what you've done.
Yeah, it's good that which is back to the reason why I've done all this is to make a difference, and it seems like I have. So I'm happy.
Well, many people are saying it online, and I'm going to say it now. Thank you for everything you've done. And even though you're in a few days, you step into a new phase, we know that same you is just going to keep on rolling.
Yeah. Thank you.
It'll be great to see what it becomes.
Yeah, who knows? It would be nice to have a crystal ball and look into the future, but maybe not.
Maybe not.
No, just let things happen. Thank you.
Did you enjoy this episode of POSLink Plus Listen? You can find more episodes on our website or wherever you get your podcasts. Don't forget to subscribe to stay up to date, and for more information, head to lpv.org.au and follow us on our social channels.